welcome back. And right now we're going to find out more about our last segment for today, because this is going to be a very, very important topic to be discussed, because it has to do with our health care, medical health care. This is something very, very important. Actually, this is one of our main challenges during this critical period of time. Making a more healthy or medicine. This is going to be our initiative for today to be discussed. Actually, it is very, very important to us, and to bring you some more details about this initiative, because we have more initiatives under the umbrella of this big initiative. We have the pleasure to have with us Dr.Iman Bibars. She is Regional Director of Ashoka Arab World. Good morning and welcome to the show.
Good morning.
And also we have with us Mr. Mohamed Sahar, and he is working for the company that is going to support these initiatives. First of all, good morning.
Good morning.
Welcome.
Good morning. Good morning.
First of all, if you can tell us what are the aims of Making More Health initiative, and allow me to give the floor to Ms. Dr. Iman.
Making More Health is an umbrella global support between Ashoka Global and Ashoka Arab World and the company that is supporting improving the health sector through this Making More Health initiative. The Making More Health is really about looking for social innovators, young people with new ideas that are trying to address the gaps in the system in Egypt. And the gaps could be in many ways. It could be with regards to medicine, like Medicine for All, one of the initiatives we're supporting, and they're supporting with us. Another one is Khalli Andak Dam, which is really about trying to have an online network for anybody who wants to donate or need the blood. And you know that there is a huge problem with this. And other initiatives that are also addressing different other gaps, whether it is from the supply or the demand. We elect these people, we find them, and they're very rare. They are innovative young people that are trying to address the structural problem, not really the symptoms of a problem. And with the company, there is this partnership where they are supporting us and those initiatives, not only with the funding and the money, but also with their expertise. So they help our fellows, these people that we call Ashoka fellows, these innovators, with funding, with training, with opportunities, with networking, because it's part of this CSR.
Yes.
So this is really a very brief summary, and yeah.
Yes.
It is very important actually, because talking about the social responsibility, this is an integral part when it comes to business in general. We always ask for the participation of the private sector, and they can do a lot. Egypt is rich actually with the private sector. So tell us more about how far you are cooperating with this initiative, and what are you doing exactly, and first of all, why did you take this step?
That's a nice question. Actually, my company believes in its role as a social responsibility. Okay, we are not only looking for our business, but we are working in a country with society, and there is a need for this society, and we believe in our social and or CSR, which is corporate social responsibility, towards the people we are living among. Coming up and forward from this belief, we have and we already proud of having the partnership with Ashoka. Okay, so my company has a partnership now. It's 5 years. It's since 2010. We are in a partnership with Ashoka, and we have the initiative together, which is Making More Health. Okay, under this initiative, what we are aim, and this is our major objective, and we have the same values, by the way. That's why we have this successful partnership for 5 years. We have the same values and the same objectives. Our objective is to support, and so if we like to support, first we need to find the initiatives from the people we are living among. We have a lot of initiatives, and they are submitted to Ashoka. Ashoka start a long process, maybe for 6, 7, sometimes 8 months, just studying the initiatives they have from the people. Then they will start to contact with us. That we have 1, 2, 3 initiatives, which one is okay for you? And we start our discussion. And we will end up with maybe 1 or 2. We are not looking for quantity. We are looking for the quality.
Yes.
That's why we are taking our time, because what we are looking for is new idea, new initiatives, something we will be sure it will reflect on the society, not just an idea for 1 month, 2 months with just a acute solution. We are looking for solution which will reflect on the society. And in the same time, for my company, we are looking for the idea which is following the ethics we all believe in, and the society already working on. So this is how we are choosing. We have some initiatives already going on with partnership with Ashoka. We have, as Dr. Iman said, we have لو عندك دم, that was by Hisham last year. We have waleed also, medicine for all. And what they are looking for is we have the people who need, and we have the people who are willing to donate. And what we are looking for from لو عندك دم or medicine for all, and this is what encouraged us to take these initiatives, that they are making the platform and already the common ground for who want and who want to donate. So for blood, for medicine, we have the bridging between and coordinate between these two people, these poor people and want and in need, and we have the people who are willing to donate, but maybe they don't know where to donate the medicine.
It's just a matter of coordination.
Just a matter of coordination,
yes.
And to make sure that we are connected together to achieve what we are looking for.
Dr. Iman, if you can tell us also, how can Make More Health enhance and improve the healthcare services here in Egypt?
Making more health as an umbrella, the aim is how can we make more health? How can we have more healthy people? And it is a very important initiative because it is not limited to one part of health. So for making more health, we are looking for what are the gaps in the health system, and especially what are the gaps when we come to the most needy, to the poor, to the people who have no access to health services, because if you want, and especially now, if we want a very productive community, you have to have healthy people. So it will enhance it because it is ideas that are coming from the ground. You know, it is coming from the problems of the communities. It is not somebody who's sitting in an office and thinking, let's do whatever we're doing. On the contrary, we're looking for these innovative young people. So to start with, we're helping young people with new ideas. You know, we have a lot of young people, but we also believe that if you really want to build this country, you have to come up with new ideas. So we look for people with new ideas, innovative ideas, but also ideas, as Dr. Mohamed was saying, that are really addressing the structural problems. For example, in medicine for all, this we have a big issue with medicine. On one hand, it is expensive for a lot of people. On the other hand, we have a lot of waste. We have 1 million Egyptian pounds wasted medicine across Egypt per year. If we say that, let's assume that every person will have, for example, prescription for 100 pounds, that means we can save 10 million people. So what did Waleed decide to do? Waleed decided to say, Egyptians and pharmaceutical companies and pharmacies, everybody, you have a lot of excess. So you and I, sometimes you want to have 15 tablets of a particular medicine, but then the package is really 50. What you do is you take your 15 tablets, but then you throw 35. He went through 30 NGOs in Egypt, and he told them, I want to find out in your areas what are the type of diseases that people have.
The most familiar.
The most familiar, the most common. And so some of them are acute, which means you need every month, and some of them are whatever you need. And then he went to the affluent people and to the pharmacies and said, you waste. Sometimes, you know, there is not a lot of demand, there is 6 months before the for people like us. He went through the universities. He created pharmacies in the universities where the pharmaceutical kids are the ones who are learning to classify them. And he was able to mix and to match them together, to the extent that there are 1,000 patients every month now that have medicines that are very good medicines, that are not expired, that are being tested by the regulatory groups. But also the most important other thing, also he created Okful Marid. So for example, if somebody has an acute disease with a medicine that is very expensive, people now are saying, okay, I will buy this medicine. And it is sustainable because there is a lot of that. Every one of us, how many medicine things you have at home that you're not using. So, and he was able to create, to get the students of the pharmaceutical companies to classify them, to make sure that they are good, to throw whatever is not needed, so it's very healthy. And so the kids now are being trained on the job. So you see, what we are looking for are teamwork. We are looking for a group of people that are really interested in finding training for the kids. Now, poor people are getting the medicine. Affluent people are able to give to the community without anybody going the extra mile or doing something that he's not doing. With Hisham Kharma, on the other hand, we have a big issue with blood. And one of the biggest problems is you want to donate, you don't know where to donate. But not only that, because Hisham Kharma has created an online platform whereby he's connecting banks with hospitals, with the individuals. So let's say I go to a hospital and they say I need blood A. Nobody knows. Maybe the bank on the other side in the same street has blood A, but nobody knows. Now you can. You go on the website, خلي عندك دم. You say, I want to contribute. So somebody says, we need your blood somewhere else, and you immediately go. But also the hospital will go online and say to the patient, there is a blood bank 2 blocks away, and you can find it. And so this is addressing real problems without superficiality, because there is a need. It is made by young people in Egypt, so this is great. These Hisham and Waleed are young people in their 30s that decided to go out of their way. Hisham is really an engineer, but he decided to do this because this is what Egypt needs.
Out of passion.
Out of passion and care. And what is also important is that it's creating they are role models for other kids, young people, young adults, but it's also, they are creating a feeling among the community that I am helping. So I don't need to do a lot of things, I am helping, I'm contributing. So there is also this sense of ownership, of patriotism, of the feeling that I have a role. Companies are now very, very ethical about their CSR, but also communities are being also very, very ethical about their social responsibility.
It is very important, very, very important, because talking about medicine waste, this is one of our, one of the problems actually we are facing, but also talking about training the youth and training people how to work with this, because always, most of the time, the problem is with our behavior, in us. We are the source of our problems, actually. So talking about this and training and teaching people, teaching the youth in particular, tell us more about this, and how do you see people who just come to attend, and I believe you are doing this for free, if I understood correctly, yes? Tell us more about it.
Actually, with training, you are touching the most crucial point in just make sure that we will continue our success. Because already we agree with Ashoka that we don't like to have initiative with somebody is just dreaming. One of our conditions that the initiatives is already running since a long time. لو عندك دم or medicine for all, it's 5-6 years old initiatives, okay? And once we see the willing in the people, we see the owner of initiatives is willing and start working, what we are doing is what actually mentioned, that we are supporting. What kind of support we have? We already fund the training. We make exposure, because it will need some meetings, some publicity. So we are supporting with training, with some of exposure to the media. So he will be wide his scope and will be exposed to many of the society and who will need his initiatives. One of the issues as well, we maybe will send him to international conference, so he can see what's happening outside Egypt, and he can transfer this experience to Egypt as well. So we have a lot of ways to support, but what we are looking for in the beginning is that he had the will, because what we need is, besides training, sure, we need to have the willing to do the things, so we will make sure that he will success. And what we are doing is to make sure he will continue his success for a long time. He will improve, he will develop his idea, and he will reach to a wider scope of the society.
Yes. Dr. Iman, your final comments, please. We have 30 seconds.
Okay. The final comment is that Ashoka looks for social entrepreneurs. We call them social entrepreneurs, people who are obsessed with an idea that want to build this country. We partner them with expertise and private sector, because we believe, but we also choose the private sector with ethical values. We want people with ethics, but also with passion and commitment. And we look for them and support them, not only in health, in everything. We have 80 fellows across the Arab world. 40 of them are in Egypt. Majority of them are young people that care about this country, that want to build this country, and we are there to support whoever loves Egypt and wants to help it.
Yes. At the end, we do appreciate your insight and presence, Dr. Iman Bibars, the Regional Director of Ashoka Arab World, and Dr. Mohamed Sahar, the head of a pharmaceutical company. Thank you so much for joining us on The Breakfast Show.
Thank you very much.
Thank you very much. And good morning.
Thank you very much for joining us. With this, we come to the end of our breakfast show for today. Thank you all for joining us. And remember to join us again tomorrow with our colleagues for more on The Breakfast Show. Till then, thank you for joining us, and stay tuned for more coming up on Nile TV International.
مصر بتسلم عليكو، مصر بتناديكو بتناديكو، ايدنا بايديكو نعمل معجزات. مصر فاتحة لكم ايديها. It's the land of inspiration, middle of civilization. Egypt is the great gift of the Nile. With more work and dedication, and with the people's love and devotion, Egypt will be rising once again. Pour l'Égypte de nos jours, peuple uni